Struggling with mental health or confused by the system? With over 2 decades in psychiatry and mental health, I'm here to break it down, bust myths, and bring hope. Let's talk mental health. Real, honest, and empowering.
Hello. My name is Dr. Mary Opara, and welcome to another, episode of ADHD. So today we're going to be talking about how to obtain ADHD prescriptions without any challenges. So for those who don't know me, I'm Dr. Mary Opara, and I am here to educate, inform, and spread awareness to help you obtain mental clarity. So if you didn't catch the last episode of ADHD last week, maybe go back and watch it because that one leads into this one. So, and I did promise to do part 2 to help people that have truly suffered with ADHD for so long, have learned to master their symptoms for so long, to help them be able to obtain their meds. So if you've ever felt that you're not good enough because of the way you feel, because of your ADHD, please hear me. It's not your fault. So if you've been unable to obtain prescriptions to help you manage your ADHD symptoms, and finally, if you are at your breaking point, this is for you. I have some mind-blowing advice today, so stay tuned. Don't go anywhere. So here's my gift to you. This is something most people don't know about, and I think knowledge is power. So stop wasting your time filling out all those online checklists that you see online that says ADHD. Stop arguing with providers that I know what I have these symptoms, and I think that that should be enough for me to get the medications that I need. The questionnaire that we see and do online most of the times is a baseline. We look at it, that helps us get some information. It's not because anybody is doubting that you have those symptoms, but most providers would prefer that you get a psychological testing. So, in other words, stop going from provider to provider out there to see if you can get the meds that you need, and then leave upset because you weren't able to obtain those prescriptions, even though you so much need it. So I'm going to tell you how to cut all that out. So this is what you do instead. In your area, in the state where you live, look for a board certified psychologist that does ADHD testing to test for your ADHD. And notice that I didn't say therapists, and I didn't say counselor, and I didn't say nurse practitioner. I said certified psychologists. They do the testing for ADHD. And their testing is considered the gold standard because of the tools that they use, because of the structure that they use, and the in-depth of their assessments. Sometimes the assessments could be 2-3 pages long, but that is the gold standard. I have an announcement. There we go again. Just ignore me. Please share to all you know, subscribe, ring the notification bell to know when new videos become available, okay? I'm just being silly, but hey, come on, guys, help me get some subscriptions here. All right, so going back to what I was talking about, these psychologists that are board certified do a very comprehensive clinical interview. It's an in-depth interview that they do. And in that interview, they cover everything. They go over the symptoms of focus, distractibility, impulsivity, restlessness, forgetfulness, disorganization. They go over everything. But what makes it a little different is that they go over everything. They do the history from your childhood, your developmental history, whether you were premature, whatever happened in your life from that age. And ADHD must have started before age 12. those issues. You would have had reports from school, reports from teacher. Your parents would know too because of the way you do things at home. So the psychologists obtain that, and then they obtain your academic history, how you did in school. Did you drop out of school? Was school frustrating for you? Were you not able to do school? So did you have all those ADHD symptoms? So they look at all of that. And then they ask you for your occupation history, your work history. Are you unable to get work done? Do you procrastinate? Are you able to meet your deadlines? Do you lack focus at work? Do you jump from one thing to the other? And relationships. They ask you about your relationships. Do you function in your relationships? How well do you function in your relationships? Do you argue over forgetting things? Do you frustrate your partner? Do you get distracted when they're talking to you about things that are important? Do you not even pay attention sometimes? And then they get your medical, and then they get your psychiatric history. They do that to rule out depression, anxiety, trauma, or sleep disorders. Then they get your family history of ADHD or other mental health conditions. Because when they do that, that helps them determine if your symptoms are consistent, chronic, are they impairing for you, or is it just occasional stress related symptoms that you have? They obtain your medical um, and psychiatric history, like I said, and then your family history. Whether there's anybody else in the family that has ADHD or has symptoms, because most of the times ADHD runs in the family. It's a genetic disorder. So that helps the providers when they obtain all that information. Sometimes people will say, yeah, my father has it, my grandfather has it, my mother has it, her mother has symptoms like that. Then that helps the psychologist as well. Then they do other tests. There are a whole bunch of tests that they do, which are tools. They use the tools to do it. I'm just going to throw some of them out there. Some do different ones, some do these and more. Some don't do these, but do other ones. But pretty much, these are just some of the ones that I know of that they do. It's not an exhaustive list, like I said, but it's just to give you an idea of some of the tests they do. So here is a list of some of the tests that they would do. These are standardized rating scales, common tools that measure the ADHD symptoms, and it measures the ADHD severity of those symptoms. So here they are. I'm not going to try and pronounce all these because a lot of them are tongue twisters for me. So, but pretty much you can see them there. And like I said, these are not the ones that all of them use. Some use some of them, and some of them, there is so many testing that psychologists use. Some might use few of these, and some might have ones that are not even included in this list that they use as well. So, but this is just an idea of some of them that they might tell you to do. Uh, like I said, it's not exhaustive. So I'm just giving you the few that I've picked up from the testing that I've had a lot of psychologists do. And when I get the report back, these are some of the ones that I was able to get out of it. So few of them I see repetitive in most of the psychological evaluations that are done that I get back. And then there's some that are on this list that I don't see in others. And that's why I know that not all the psychologists do the exact same tests. But the one they call the Connors and the Westler, whatever, I'd see that a lot. And then there is also testing that they do, which is the neuropsychological testing, because some psychologists even go deeper. They go a little further with this by testing the attention and executive function. Some of them do that testing, which they call the CPT, continuous performance tests, that measures attention, impulsivity, and whether you're able to have a sustained focus. They test working memory, how fast you are at processing, like your speed, the speed processing tests. They do the executive function tests, like how you planning whether you have inhibition, cognitive flexibility, those kind of tests. So that helps them to be able to distinguish whether it is ADHD or cognitive issues that you have. By doing that, they know whether some of these issues are depression related or whether they're concentration or whether it's maybe a brain injury. So these tests they do, and sometimes the client, and sometimes even a partner, a fed up partner or friend who knows the client well enough, the person that's being assessed well enough, and see these settings in different environments would come and help um, do that. So all that is the rule out process that the psychologists do to ensure that the symptoms are not explained by other things, because sometimes you could get some symptoms that look like they might be ADHD, but they could be bipolar, it could be trauma, it could be substance use, it could be sleep disorders, it could be thyroid issues. So that is why it's always good to do this differential diagnosis that we do, just to make sure that it's not something that is not ADHD, but mimics ADHD. So I hope this information helps. If you have any questions, please write in the comment section. Feel free to send an email to me. Right now, I'm using the mental clarity program at gmail.com, the mental clarity program at gmail.com. Thanks for spending this time with me, Clarity Fam. Don't forget to like, don't forget to share, don't forget to subscribe. And meet me back here next Friday for more insights, more healing, and more clarity. Until then, take good care of your mind and your heart. And remember, I care for you and I love you. See you on Friday. Bye for now.
Thanks for spending time with me, Dr. Mary Opara. Don't miss next Friday for another powerful session. Until then, like, share, and subscribe to keep the conversation going. See you soon.